Hello, doctors. Today we are going to learn about the topic vaginitis. This is a very important topic in gynecology because vaginitis is one of the most common problems for which women present in the OPD. So we'll go through the definition, causes, types, and clinical features, diagnosis and management in both OPD and IPD basis and complications. So let's move forward with the topic. So, what is vaginitis? Vaginitis means inflammation of the vagina, usually due to an infection, but sometimes due to a non-infectious causes like chemical irritants or allergens and all. It is characterized by vaginal discharge, itching, burning, and discomfort. And always remember, every patient who comes with discharge per vaginum is not necessarily vaginitis. We must differentiate it carefully. And there are many types of vaginitis. Bacterial vaginosis, candidiasis, trichomoniasis are the uh, different types of vaginitis, and there are also non-infectious vaginitis also. So we'll discuss one by one. First, we'll see about the normal vaginal environment. So normally our vaginal environment in the women predominantly lactobacillus species, and it have a normal pH from 3.8 to 4.5. It maintains an acidic pH, and it plays a protective role against the pathogens. So this is the normal vaginal environment, uh, which is like commonly present in the normal female women. So when there is any variations in this things, there can be it can lead to vaginitis. So what causes vaginitis? What is the etiology of vaginitis? Infectious, you can see bacterial infection or fungal or parasitic, maybe because of that. Non-infectious, non-infectious like atrophic, postmenopausal, allergic irritant. Iatrogenic, maybe because of antibiotics, steroids, or immunosuppression. So there are three main infectious causes. When you're talking about the like types of vaginitis, as I've mentioned, bacterial, candidiasis, trichomonas. So bacterial vaginitis is caused due to the overgrowth of anaerobic bacteria and the replacement of lactobacilli. Vulvovaginal candidiasis, it is caused by the Candida albicans. Trichomonas vaginitis is caused by Trichomonas vaginalis. So apart from these, there are non-infection causes like chemical irritants, allergens, and atrophic vaginitis in the post-menopausal women. So these are the etiology of vaginitis, what causes the problem vaginitis. Moving on to the types of vaginitis, we'll discuss one by one. So we can type while talking about the types of vaginitis, we can broadly divide into two, that is infectious and non-infectious. Under infections, we'll be discussing bacterial, candidial, trichomonas, and under non-infectious, it is due to the allergic, chemical irritation, atrophic. So among these, the big three important are bacterial vaginitis, candidiasis, and trichomonas. So nearly 90% of the infection are the infectious cases, maybe, and that from among the 90 percentage of infectious causes, it can be because of bacterial, candida, or trichomonas. So first thing we'll do talk about the bacterial vaginos or BV. Most common cause of vaginal discharge in the reproductive age. So when most of the time people comes with OPD with the vaginitis, most cause will be bacteria. It is caused due to the overgrowth of anaerobes and reduction of lactobacillus. So as I've mentioned, the normal environment of the vagina is lactobacillus species. So when there is an overgrowth of anaerobes, there will be reduction of the lactobacilli. So that can cause the bacterial vaginosis. And the symptoms you can see, there will be thin gray white discharge, and there will be fishy odor which is worse after intercourse. So these are the common main important symptoms you can see in the like you can see in the patient's side, from the patient side. So this is the like a brief intro of what is bacterial vaginosis. And bacterial vaginosis, you can, like, how we can diagnose. So you can see under the patient like image, the vaginosis, how the bacterial vaginosis will be seen. So diagnosis is done with the Amsel's criteria. So these, there are four criteria, Amsel's criteria, and Amsel's criteria. If among these four, if it is greater than or equal to 3 of these four, then it is a bacterial vaginosis. First one is look for a homogeneous thin discharge, and the vaginal pH will be greater than 4.5, and positive whiff test, like amine order with KOH, clue cells on microscopy. On microscopy you can see the clue cells. So these are the thing. With this diagnosis, with this we can diagnose the bacterial vaginosis condition. Whiff test means the fishy order, which I have mentioned a symptom, fishy order with the KOH, which will suggest the bacterial vaginosis. Moving on to the management, how we can manage the bacterial vaginosis in the OPD and IPD basis. In OPD, you can advise metronidazole 500 mg POBID for 7 days, or metronidazole gel 0.75% intravaginal for 5 days. So this you can advise the patient in OPD basis management. And alternative you can give is clindamycin cream 2% intravaginal for 7 days. This is the OPD thing. And IPD rarely needed, because usually this is an OPD case, and admit if the patient have severe pelvic inflammatory disease and all disorder suspicion or complications, then you can admit the patient in the IPD and do the treatments accordingly. So this is how we have to manage the bacterial vaginitis. So that is what about what bacterial vaginitis, what it is. But we have discussed bacterial vaginitis, what it is, how it is caused, what are the causes, and the type, symptoms, and how we can diagnose it, and how we can treat in the OPD and IPD. Now, coming to the candidiasis. So this is one of the second most common cause of the vaginitis. It is caused due to the Candida albicans. Most of the time, 90% of the time, it is caused due to the Candida albicans. And the symptoms the patients say is like they have intense itching, or there can be thick curdy white discharge, vulvar erythema, or these are the symptoms you can see in candidiasis. And there are few risk factors also in case of antibiotics, diabetes, pregnancy, and immunosuppression. So these are the cases where there is risk factor in the candidiasis. How to diagnose candidiasis? Clinical diagnosis is often sufficient. Microscopy, KOH preparation, so you can see budding, yeast, pseudo hyphae. You can send for culture for recurrent or refractory cases. You can go for culture. So vulvovaginal candidiasis, you can see how it is. I have in the picture, it is clearly, you can see clear picture of that vulvovaginal candidiasis. So this is how it looks, the like the sample. So that sample you can give it for culture. You can take it and give it for culture for recurrent, in cases of recurrent and refractory cases. So this is how you can diagnose the candidiasis condition. Moving on to the management, how you can treat the candidiasis in OPD and IPD. OPD, you can give a clotrimazole vaginal tablet or cream for 7 to 14 days, or fluconazole 150 mg PO single dose. You can give advice. And if this candidiasis condition is recurrent for more than 4 years, then fluconazole weekly for 6 months, it is advisable. So you can give this in the OPD basis. And in IPD, IPD is rare, admit only if immunocompromised and any systemic candidiasis is suspected, then go for the IPD care. So here you have to keep in mind about the symptoms, causes, and the management, the medicines, tablets or vaginal tablets and medications name. So candidiasis, we learned what it is candidiasis, what causes candidiasis, and what are the symptoms of candidiasis, how we can diagnose the condition, and how we can manage the condition OPD and IPD basis. Now, moving on to the next, trichomoniasis. So trichomoniasis, it is a sexually transmitted infection. So the organism here is involved is Trichomonas vaginalis, that is protozoa. It is a protozoa. The symptoms you can see here is, if it is a sexually transmitted infection. So you can see frothy yellow green discharge with foul odor, and you can see strawberry cervix. Yeah, I have put the picture down there. You can see how the cervix looks like, the strawberry cervix. So you can see some dots, kind of like a strawberry skin. You can see like the cervix will be looking like you can see the cervix like that, that we call like a strawberry cervix, and often asymptomatic in men reservoir. So trichomoniasis is usually sexually transmitted infection, usually often asymptomatic in men, and organism, that is Trichomonas vaginalis. Symptoms you can see through the yellow green discharge. The main you can see while examination, if you see strawberry cervix and all, you can maybe correlate this that thing with the trichomoniasis infection, Trichomonas vaginitis. So that is the key point here, strawberry cervix in trichomoniasis vaginitis. Moving on to the diagnosis. Here the symptoms, as I have mentioned, the most men do not have symptoms, only mild ones, but women will have that vaginal itching and all, and around the surrounding area, pain when you like a frothy colored discharge and all. You can see when if as it is a sexually transmitted diseases, men will not have symptoms, but there will be discharge and pain when urinating. That is the symptoms, but not but most of the time it's asymptomatic. Women experience the symptoms. And diagnosis, how we can do: microscopy for motile trichomonads, then pH will be usually greater than 4.5 in trichomoniasis cases, and you can go for NAAT gold standard. That is the gold standard for diagnosing the trichomoniasis cases. So this is the important part of trichomoniasis, because sexually transmitted disease, right? So you have to do accordingly. And most important is wet mount for trichomonas. So that is the diagnosis of trichomoniasis. And trichomoniasis, how we can manage it. OPD basis, you can advise metronidazole 2 gram PO single dose or 500 mg PO BID for 7 days. Treat the sexual partner simultaneously. Not only to the women, you also have to treat the partner simultaneously. And in IPD, rare cases, admit only if there is any severe pelvic inflammatory disorder. So that is the management in IPD basis you can do for the trichomoniasis. So we talked about the non-infectious vaginitis, like infectious vaginitis, that is bacterial trichomonas and trichomoniasis and candidiasis. So now we'll talk about the non-infectious vaginitis. So non-infectious vaginitis, it is it's divided into various types, like atrophic vaginitis, that is post-menopausal. It is mainly due to the estrogen deficiency. It can lead to dryness and irritation in the vagina. Next is the allergic and irritant, like maybe because of the chemicals or contraceptives or soap allergy and all, that can cause any vaginitis. Foreign body, maybe because of the condom or retained tampon and all, there can be that these also can lead to a non-infectious vaginitis. So non-infectious vaginitis basically because of the atopic vaginitis, estrogen deficiency in the post-menopause stage, allergic or irritant because of the soap, chemicals and contraceptives, and foreign body may be caused due to the tampon or condom. Talking about the complications, so complications in bacterial vaginitis, there is a risk of preterm labor, post-surgical infections also. In trichomonas, increased HIV transmission risk is present. Candidiasis, there are recurrent infections which will reduce QOL. And the need for counseling, STI screening, partner treatment is essential. So whenever there is a complication because of the vaginitis, you should properly counsel the patient. So need of counseling is required. And go for a sexually transmitted infectious screening, and as well as partner treatment. So you should always treat the partner, sexual partner also accordingly, simultaneously along with the patient. So these are the complications of vaginitis. So now, so these are the common things which we discussed today. And not only managing the condition, we also have to advise the patient how they can prevent these conditions. So prevention is as important as the treatment. Proper, you can advise for a proper genital hygiene, avoid douching and harsh chemicals in the vagina, safe sexual practices and partner treatment also, and control of diabetes in recurrent candidiasis. So in case of candidiasis, like if the patient is have a candidiasis vaginitis, ask them to control the diabetes, and use of probiotics to maintain the normal flora in some cases. So probiotic in some cases, you to get back the normal vaginal environment, the use of probiotics can be done. So by practicing these things, to an extent we can prevent the we can counsel the patient to prevent these from getting again getting the vaginitis thing. So these are the prevention thing you have to keep, like you have to tell to the patient whenever patient comes to the OPD level. And about the management, we have already discussed. So treatment is always cause specific, so we should not give random antibiotics for every discharge. Our management has two important parts, OPD based and IPD based. So we should go each one by one. So coming to the conclusion of today's session, to summarize this, vaginitis is a very common OPD problem. Then we have to differentiate vaginitis whether it is infectious or non-infectious causes. The causes can include bacterial vaginosis, candidiasis, and trichomonas. So each has a typical discharge features as we have discussed in the previous slides. And use clinical simple investigation for diagnosis. Don't go for many different types of investigations in order to rule out the diagnosis. If you know the symptoms properly, if you know the symptoms and if you know the disease, like different, you can, if you are able to differentiate which is infectious or non-infectious cause, or while taking the history of the patient itself, you while taking the history of the patient itself, you will get to know which kind of vaginitis they might have. And after doing the examination, you can rule out which type of infection vaginitis is. So use a simple clinical methods and simple investigation for diagnosis. And management is mainly OPD, IPD only for severe and any other refractory cases. So usually it is an OPD basis treatment condition. And always counsel about the recurrence, partner treatment and prevention. So you should always during the management time, always counsel the patient, maybe because the vaginitis can reoccur also. So about the recurrence also you should counsel, and also advice to be given to the partner also, sexual partner, and also advise them to get the treatment done, and also advise whatever prevention which I have mentioned, you can guide them to prevent it from getting to prevent the vaginitis from the future. And There will be complications also in severe cases. So as soon as when they get the symptoms like that, it is better counsel the patient. As soon as if they feel or see such symptoms, they can come and get the treatment done. So most of the time, as I've mentioned, treatment is cause specific. And so in OPD practice, every case of vaginal discharge must be carefully evaluated and managed properly. So this is all about today's session, vaginitis. I hope you understood the topic. So thank you so much for patient listening and have a nice day. Thank you.